That persistent feeling that something is just off with your body. A collection of seemingly random minor complaints that you've learned to live with. What if they aren't random at all? What if they were a carefully disguised constellation of clues, all pointing to a single hidden culprit? This is the reality of Sjogren's syndrome, a systemic autoimmune disease affecting as many as 4 million people in the US alone. A staggering 9 out of 10 of them are women. In Sjogren's, your immune system goes rogue, launching a stealth attack on your own body. Yet despite its prevalence, the path to a diagnosis is dangerously long. The average time from the first sign to a correct diagnosis is nearly 3 years. Why does this happen? Because Sjogren's doesn't announce itself with dramatic, obvious problems. It whispers. The early warning signs are so subtle that both patients and doctors routinely miss them. In fact, studies indicate that 90% of people with Sjogren's go undiagnosed or misdiagnosed initially. If you've been feeling off lately, experiencing things you can't quite explain but keep telling yourself aren't serious enough to worry about, you need to pay attention right now. Because recognizing what your body is trying to tell you early could mean the difference between simple management and serious complications. Note, this video is for educational purposes only and not a substitute for professional medical advice. Always consult a qualified healthcare provider about your health. All information shared is backed by credible, peer-reviewed research with links to the original studies and the description. 1. Xerostomia, dry mouth. Imagine waking up every morning feeling like you've been chewing cotton balls all night. That parched, sticky sensation in your mouth isn't just morning breath. It could be xerostomia, the medical term for chronic dry mouth. According to the International Journal of Molecular Sciences published in 2023, this condition affects nearly 94% of Sjogren's syndrome patients, making it the most common warning sign that people tragically dismiss as normal aging or dehydration. Your salivary glands are under attack when you have Sjogren's syndrome. Lymphocytes, which are white blood cells that normally protect you from infection, mistakenly infiltrate these glands and destroy their ability to produce saliva. The Big Data Sjogren Project Consortium, analyzing over 6,000 patients, confirmed this process called lymphocytic infiltration can be demonstrated through biopsy showing at least 50 lymphocytes clustered in a 4 square millimeter area of gland tissue. The consequences extend far beyond simple discomfort. Without adequate saliva, your teeth become vulnerable to cavities because saliva naturally neutralizes acids and washes away bacteria. Many patients develop oral candidiasis, a fungal infection commonly known as thrush, which appears as white patches inside the mouth. Eating becomes a daily struggle when your mouth can't produce enough saliva. Dry foods like crackers feel like sandpaper, and swallowing becomes painful and difficult. Some patients report needing water just to speak clearly, as their tongue sticks to the roof of their mouth mid-conversation. The demographic data reveals fascinating patterns about who's most affected. Women between ages 50 and 59 face the highest risk, with a meta-analysis of 211,349 individuals showing 24% prevalence in this age group. Large registry data confirms that xerostomia isn't just common, it's nearly universal in Sjogren's syndrome, appearing years before diagnosis in many cases. 2. Keratoconjunctivitis sicca, dry eye. Your eyes are burning, itching, and feeling like someone poured sand into them. This isn't just eye strain from staring at screens, it's keratoconjunctivitis sicca, affecting up to 95% of Sjogren's syndrome patients, according to the International Journal of Molecular Sciences in 2025. The medical term literally means dry inflammation of the cornea and conjunctiva, the clear tissues covering your eye surface. The autoimmune assault on your lacrimal glands, which produce tears, parallels what happens in salivary glands. These glands lose their ability to maintain the tear film that keeps your eyes moist and protected. A multi-center registry confirmed objective dry eye in 92% of over 6,000 patients, while a geriatric population-based study detected dry eye in 20.9% via objective measures, regardless of subjective reporting. Patients often describe experiencing paradoxical excessive tearing, where their eyes water constantly, yet still feel dry. This happens because the eyes produce poor quality tears, lacking essential oils and proteins. The tears evaporate too quickly, leaving the surface unprotected and triggering more reflex tearing in a frustrating cycle. According to Biomolecules Journal in 2024, photophobia, or extreme sensitivity to light, forces many patients to wear sunglasses even indoors. Blurred vision becomes progressively worse throughout the day as the corneal surface deteriorates. Some patients report their eyelids sticking to their eyeballs upon waking, requiring artificial tears just to open their eyes safely. The Sjogrens test provides objective measurement of tear production by placing a small paper strip under the lower eyelid. A reading of 5 millimeters or less after 5 minutes indicates severe dryness. Advanced cases show epithelial erosions, tiny scratches on the eye surface, and corneal calcification where calcium deposits form due to chronic inflammation. 3. Arthralgia and arthritis. Joint pain strikes up to 67% of Sjogren's syndrome patients, according to systematic reviews, yet many dismiss it as simple aging or overexertion. The medical term arthralgia refers to joint pain without visible swelling, while arthritis involves actual joint inflammation found in 30 to 45% of cases based on large registries. Both conditions significantly impact daily activities, from opening jars to typing on keyboards. The proximal interphalangeal joints, the middle knuckles of your fingers, bear the brunt of this autoimmune attack. The metacarpophalangeal joints, where fingers connect to the hand, also frequently become painful and stiff. The International Journal of Molecular Sciences in 2023 reported that unlike rheumatoid arthritis, Sjogren's-related joint involvement rarely causes permanent bone erosion or deformity. The immune system's type 1 interferon pathway plays a crucial role in triggering joint inflammation. This pathway activates B cells, which produce antibodies, and stimulates release of inflammatory cytokines like interleukin-6, interleukin-21, and interleukin-23. These chemical messengers create a cascade of inflammation affecting both joints and glands simultaneously, as documented in comprehensive immunopathogenic mechanism studies. Morning stiffness lasting more than 1 hour becomes a daily ritual for many patients. The pain often migrates between joints, confusing both patients and doctors who might attribute it to various other conditions. Some days the wrists hurt, other days it's the knees or shoulders, creating an unpredictable pattern of discomfort. Tendomyalgia, or tendon pain, frequently accompanies joint symptoms in Sjogren's syndrome. This combination of joint and soft tissue pain severely impacts quality of life measures in research studies. The overlap with other autoimmune conditions like lupus or rheumatoid arthritis can complicate diagnosis, as joint symptoms alone don't definitively point to Sjogren's syndrome without accompanying sicca symptoms. 4. Parotid gland enlargement, sialidinitis. Your face appears puffy, particularly around the angle of your jaw, creating an appearance some describe as chipmunk cheeks. This swelling indicates parotid gland enlargement, medically termed sialadenitis, affecting approximately 36.2% of Sjogren's patients, according to the Journal of Rheumatology's 2022 study of 668 patients. The parotid glands, your largest salivary glands located in front of each ear, become infiltrated with immune cells. The swelling pattern provides crucial diagnostic clues about disease progression and potential complications. Intermittent swelling that comes and goes might indicate active inflammation, while persistent enlargement raises serious concerns. Unilateral swelling, affecting only one side, serves as a red flag for possible malignant transformation, according to rheumatology consensus guidelines. Lymphocytes aggregate within the gland tissue, forming organized structures that resemble lymph nodes. These cellular infiltrates progressively destroy the normal glandular architecture, replacing functional tissue with inflammatory cells. Biopsy specimens reveal dense collections of B and T lymphocytes, confirming the autoimmune nature of the swelling. The connection between parotid enlargement and lymphoma risk cannot be overstated. Sjogren's patients face 15 to 20 times higher risk of developing mucosa-associated lymphoid tissue, MALT, lymphoma, compared to the general population. Persistent parotid swelling often precedes lymphoma diagnosis by months or years, making regular monitoring essential for early detection. Laboratory findings in patients with parotid enlargement typically show elevated autoantibodies, particularly anti-Rho, anti-SSA, and anti-LAW-SSB. Rheumatoid factor positivity and high ESSDI scores, a measure of disease activity, correlate with glandular swelling. The presence of parotid enlargement often indicates more aggressive disease requiring closer surveillance and potentially more intensive treatment to prevent progression to lymphoma. 5. Cutaneous vasculitis and purpura. purple spots suddenly appear on your legs, looking like someone splattered paint on your skin. These marks, called purpura, result from blood leaking from damaged small vessels into surrounding tissue. Clinical Rheumatology's 2024 comprehensive review found cutaneous vasculitis affecting 9 to 16% of Sjogren's patients, representing inflammation of blood vessels in the skin that creates visible and sometimes painful lesions. Palpable purpura feels raised when you run your finger over it, distinguishing it from simple bruising. Non-palpable purpura lies flat against the skin's surface but doesn't blanch, turn white when pressed. Urticarial vasculitis presents as hive-like welts that persist longer than 24 hours, unlike typical allergic hives that come and go quickly. Type 2 cryoglobulonemic vasculitis involves abnormal proteins called cryoglobulins that precipitate in cold temperatures. These proteins clog small blood vessels, particularly in the skin, kidneys, and nerves. Patients with this variant face significantly higher risks of systemic complications and require aggressive monitoring and treatment based on meta-analyses and registry data. Skin biopsy reveals leukocytoclastic vasculitis, where white blood cells break apart within vessel walls, releasing destructive enzymes. This process damages the vessel integrity, allowing blood to escape into surrounding tissues. The microscopic appearance shows neutrophils, a type of white blood cell, infiltrating and destroying vessel walls. JAMA Dermatology's 2025 cohort study of 54 Sjogren's patients with cutaneous vasculitis reported alarming correlations with lymphoma development. The study found 13% lymphoma rates in patients with vasculitis versus 4% in controls. The presence of vasculitis correlates with hypergamma-globulinemia, excessive antibody production, low complement levels, indicating immune complex consumption, and positive rheumatoid factor, all markers of severe systemic inflammation.
6. Peripheral neuropathy. Numbness creeps into your fingertips and toes, accompanied by burning sensations that worsen at night. The European Journal of Medical Research's 2023 comprehensive review found peripheral neuropathy affecting between 2% and 35% of Sjogren's patients, depending on diagnostic methods used. The wide prevalence range reflects the subtle nature of early nerve damage that often goes undetected without specialized testing. Small fiber neuropathy predominantly affects thin nerve fibers responsible for pain and temperature sensation. Patients describe feeling like they're walking on pebbles or experiencing electric shocks in their extremities. Large fiber involvement causes problems with position sense and vibration detection, leading to balance difficulties and increased fall risk according to neurological assessment studies. The pathogenic mechanisms involve multiple pathways of nerve damage in Sjogren's syndrome. Microangiopathy refers to damage of tiny blood vessels supplying nerves, starving them of oxygen and nutrients. Immune complexes deposit in the vasa nervorum, the blood vessels feeding nerves, triggering inflammation that disrupts nerve function. Dorsal root ganglia, clusters of nerve cell bodies near the spinal cord, become infiltrated with lymphocytes. This direct immune attack on nerve structures causes sensory disturbances that may precede other Sjogren's symptoms by years. Some patients experience their first neuropathy symptoms a decade before dry eyes or mouth develop. The European Journal of Medical Research identified key risk factors including longer disease duration, positive anti-SSB antibodies, and hyperglobulinemia, elevated immunoglobulin levels. Raynaud's phenomenon, where fingers turn white then blue in cold temperatures, also predicts neuropathy development. Treatment with cyclophosphamide, hydroxychloroquine, or rituximab can halt progression and sometimes reverse symptoms, but early recognition remains crucial for preventing permanent damage. 7. Cognitive dysfunction and CNS manifestations. Brain fog isn't just an excuse for forgetting appointments. It's a real neurological manifestation, affecting 30 to 60% of Sjogren's patients, according to Brain Sciences Journal's 2019 systematic review. This cognitive dysfunction encompasses problems with memory retrieval, sustained attention, and executive function, the mental skills needed for planning and decision-making. Plos-Ohn's 2025 study confirmed that formal neuropsychological testing reveals deficits even when patients appear normal in routine examinations. Central nervous system involvement extends beyond cognitive symptoms to include serious neurological conditions. Aseptic meningitis causes severe headaches and neck stiffness without bacterial infection. Transverse myelitis, inflammation of the spinal cord, can cause weakness, numbness, and bladder dysfunction that mimics multiple sclerosis, according to Neurological Case Series. MRI studies of Sjogren's patients with cognitive symptoms sometimes reveal subcortical white matter changes, areas of altered signal in the brain's connecting fibers. These changes appear as bright spots on certain MRI sequences, indicating inflammation or small vessel disease. However, many patients with significant cognitive symptoms show completely normal brain imaging, making diagnosis challenging. Rheumatology International's 2025 research highlighted that neurological symptoms precede sicca symptoms in 25 to 60% of cases. This reverse presentation often leads to years of misdiagnosis as patients undergo extensive neurological workups without considering autoimmune causes. The timing provides important diagnostic clues about underlying Sjogren syndrome. Psychiatric manifestations including depression, anxiety, and rarely psychosis can occur with CNS involvement. These symptoms result from direct inflammatory effects on brain tissue rather than psychological reactions to chronic illness. Recognition of Sjogren's related cognitive dysfunction has improved recently, but many patients still struggle to have their symptoms taken seriously by healthcare providers.
8. Interstitial lung disease. That persistent dry cough you've attributed to allergies might signal interstitial lung disease, affecting 10 to 20% of Sjogren's patients, according to population-based studies. BMC Pulmonary Medicine's 2022 retrospective study of 333 patients found 19.8% prevalence of ILD among newly diagnosed primary Sjogren's syndrome cases. ILD involves inflammation and scarring of lung tissue between air sacs, progressively impairing oxygen exchange, unlike bronchitis, which affects airways. High-resolution CT scans reveal characteristic patterns, helping doctors classify the type of lung involvement. Nonspecific interstitial pneumonia, NSIP, appears as ground glass opacities, hazy areas resembling frosted glass, in 88% of affected patients, according to the BMC study. Usual interstitial pneumonia, UIP, shows honeycomb patterns, indicating permanent scarring and carries a worse prognosis. Diffusion capacity, DLCO testing, measures how efficiently oxygen moves from lungs into blood. The 2022 study found this test drops to 75% of normal or lower in Sjogren's-related ILD, often before symptoms become noticeable. Patients might feel fine at rest, but experience shortness of breath with minimal exertion, like climbing stairs. The BMC Pulmonary Medicine research identified fascinating connections between dental health and lung disease. Rampant dental caries, severe tooth decay, correlates with ILD development, possibly due to chronic aspiration of oral bacteria. Raynaud's phenomenon, lymphopenia, low lymphocyte counts, older age, and cough also predict lung involvement, suggesting shared inflammatory pathways. Timing of ILD development varies significantly among patients with Sjogren's syndrome. While most develop lung problems years after initial diagnosis, the 2022 study found that 19.7% show lung involvement simultaneously with sicca symptoms. ESSDI scores, measuring overall disease activity, correlate strongly with ILD severity, emphasizing the systemic nature of this autoimmune disease. 9. Renal involvement and tubular nephritis. Your kidneys silently suffer damage that routine blood tests might miss entirely. Clinical Rheumatology's 2023 comprehensive review found tubulo-interstitial nephritis prevalence ranging from 0.3% to 42% of Sjogren's patients, depending on detection methods used. This wide range reflects the challenge of identifying subtle kidney dysfunction that involves lymphocytic infiltration around kidney tubules, disrupting their ability to regulate acid-base balance. Renal tubular acidosis develops when damaged tubules can't properly acidify urine. The distal type, affecting the furthest part of tubules, occurs most commonly in Sjogren's syndrome according to multicenter registry data. Patients develop metabolic acidosis, excessive blood acidity, despite normal kidney filtration rates on standard tests, confusing physicians unfamiliar with this presentation. Hypokalemia, abnormally low potassium levels, causes muscle weakness, cramping, and dangerous heart rhythm abnormalities. This electrolyte imbalance results from impaired tubular potassium handling rather than dietary deficiency. Some patients require massive potassium supplementation just to maintain borderline normal levels, according to Nephrology Case Series. Nephrocalcinosis, calcium deposits in kidneys, appears on imaging as bright spots throughout kidney tissue.
These deposits form due to chronic alkaline urine from tubular acidosis, creating an environment favoring calcium precipitation. Kidney stones develop in many patients, causing severe flank pain and potential urinary obstruction requiring emergency treatment. The 2023 review highlighted that autoantibodies targeting vacuolar H+ ATPase, an enzyme crucial for urine acidification, directly damage tubular cells. Registry data shows younger patients with RTA experience longer diagnostic delays and more active disease based on ESSDI scores. Corticosteroids and immunomodulators can improve or stabilize renal function in many cases when started early.
Number 10. Vaginal dryness and urogenital sicca. Intimate discomfort remains unspoken in many medical consultations, yet vaginal dryness affects virtually all women with Sjogren's syndrome. The Journal of Rheumatology's 2020 case control study of premenopausal women with primary Sjogren's found 100% experiencing dyspareunia, painful sexual intercourse. The same autoimmune process attacking salivary and lacrimal glands targets vaginal mucosa, causing symptoms typically associated with menopause in younger women. The 2020 study reported that 78% of participants experienced superficial pain during intercourse, with significantly reduced vaginal health index scores compared to controls. The vaginal health index measures moisture, elasticity, and pH, all of which drop dramatically in Sjogren's patients. These objective measurements validate patients' subjective experiences of severe intimate discomfort. Microscopic examination of vaginal tissue reveals periepithelial T-cell infiltration, immune cells surrounding surface cells. Reduced vascular smooth muscle content indicates blood vessel damage, decreasing natural lubrication capacity. These structural changes mirror those seen in salivary glands, confirming systemic autoimmune involvement throughout all mucous membranes. The Journal of Rheumatology researchers found elevated interferon gamma and chemokine levels in vaginal tissue. These chemical signals recruit more immune cells, perpetuating inflammation and tissue damage. The inflammatory environment also increases susceptibility to vaginal infections, creating a cycle of irritation and discomfort requiring specialized treatment approaches. Standard gynecological examinations often appear normal despite significant symptoms, leading to dismissal of patient concerns. The 2020 study found lubricant use at 56% in Sjogren's patients versus 0% in controls. Recognition of urogenital sicca as a legitimate medical issue rather than normal aging helps patients receive appropriate treatment and validation of their symptoms. Number 11. Lymphoma risk. The shadow of lymphoma looms over every Sjogren's diagnosis according to Clinical Rheumatology's 2024 systematic review and meta-analysis of 15 cohort studies. Patients face standardized incidence ratios between 8 and 19 times higher than the general population, with 2 to 9% developing lymphoma during their disease course. This cancer risk represents the most serious long-term complication of Sjogren's syndrome, predominantly manifesting as mucosa-associated lymphoid tissue, MALT type. MALT lymphoma develops from the same lymphocytes infiltrating glandular tissue in Sjogren's syndrome. Years of chronic inflammation create an environment where B cells can undergo malignant transformation. The transition from benign inflammation to cancer occurs gradually, making regular monitoring essential for early detection, according to oncology guidelines. Warning signs demanding immediate attention include persistent unilateral parotid swelling lasting months. JAMA Dermatology's 2025 study found the highest lymphoma risk in patients with type 2 cryoglobulonemic vasculitis. Purpura appearance, low complement levels C3-C4, and lymphadenopathy in large lymph nodes outside salivary glands all signal aggressive disease requiring intensive surveillance. Laboratory markers help stratify lymphoma risk in individual patients according to the 2024 meta-analysis. High rheumatoid factor titers and elevated anti-SSA, anti-SSB antibodies indicate increased risk. These factors combined with clinical features create risk scores guiding monitoring frequency and helping identify patients needing closer follow-up. The Clinical Rheumatology Review revealed lymphoma accounts for 20 to 50% of deaths in some Sjogren's cohorts, emphasizing vigilance importance. Early detection enables treatment before lymphoma spreads beyond salivary glands, dramatically improving survival rates. Regular screening with imaging and blood tests becomes crucial for high-risk patients, reinforcing why recognizing Sjogren's syndrome early matters profoundly for preventing this life-threatening complication.
Thanks so much for watching. If you found this video helpful, please give it a like, and don't forget to subscribe for more science-backed health insights.